Yeah, so I'll go ahead and kick us off with that question. So, pharmacists were really instrumental during the COVID-19 response efforts, because of them being embedded in local communities. And so here in Pennsylvania, pharmacists across our state work directly with the Pennsylvania Department of Health Bureau of Emergency Preparedness and Response in the planning phase while we were awaiting vaccination and treatment to come through the pipeline. And so uh, that particular group, we were on Zoom calls, we were coordinating directly with the Emergency Preparedness Bureau to identify pharmacies in our state where there might be lack of access to physician office practices or other places where patients could get treatment or access to vaccines. I also did some research around how pharmacists prioritize equitable vaccination of patients in their community. And we found that pharmacists were collaborating with local federally qualified health centers, physician office practices, community health centers. And so we know that access to care can be a really big barrier during a disaster and emergency, but pharmacists and pharmacies are nimble in their approach and able to reach people with therapeutic gaps. The other thing that pharmacists are really poised to do is work with providers to develop therapeutic substitution protocols or dose optimization in low resource scenarios, or even just simply teach patients about why we might not want to hoard particular medications so that our entire community can get access to appropriate antibiotics, for example, in a scenario where there would be an infectious disease spread. So those are all things that pharmacists can do to collaborate with other providers on. The other thing that I'll just mention is that pharmacists are often volunteers, also with their medical reserve corps. And so in those instances, pharmacists are collaborating with physicians, nurses, mid-level prescribers, or anybody else in a surge capacity for local response efforts. And so that's another way that pharmacists can collaborate with other providers.
So the first thing pharmacists really want to make sure we're evaluating what resources we have available to us. So that includes ourselves as a resource. So like our own clinical skills and abilities. We're highly trained to be able to ask the right questions, to evaluate, what other medications patients are on. So sometimes that's the only resource we have. But in some of those scenarios, we also might have patients who have their smartphone that has a copy of their medication list. They might have access to their medical chart that has their medications listed in there. And then also thinking about, our pharmacy chains versus our independents and the different resources that they bring in that moment. Sometimes going to a chain pharmacy that maybe it's 200 miles away, but that chain pharmacy might still have access to some of those patient records. So I think what's most important in that moment is evaluating what we have on hand, and making sure we're not turning patients away just because maybe we're stuck on what to do next, but ensuring that the patient always has access to their life-saving medications. I think what's important with that one is, pharmacists need to be able to provide strong and consistent leadership for their staff in those moments. And then we can do that by having existing emergency protocols in place for when a disaster does hit, because that does provide some additional stability and predictability in an environment that feels unstable or not predictable. So that one, I think, helps provide a sense of calm among your staff because you're like, we know what to do next. And it also allows us to respond more quickly and efficiently in a disaster when every moment counts.
I'll just chime in too that we are doing tabletop exercises and simulations at our state pharmacy association here in Pennsylvania, and you know putting pharmacists and their teams in the position of planning or simulating a disaster or emergency is another way to prepare team members to be able to respond in a real scenario. So that's the reason why we want to train folks at the state level. And then, writing your emergency plan down and having it available both electronically, but then on paper, because in several disasters, there might be power outages or we might be unable to access electronic resources, and then just reminding your technicians that they do know what to do, especially pharmacists or pharmacy technicians in community settings. They're frequently working with people who are stressed out, angry, unsure about their health care, and they deal with this every day in their day-to-day interactions, and they have that rapport with the local community. So also involving them in any of the development of your local pharmacy plan is important because they're going to bring a different perspective. Yeah, so I think this is again where our clinical training and judgment really comes in. So medications are pharmacists' bread and butter. So we're really good at being able to triage uh, different patient scenarios and prioritize making sure that patients are getting life-sustaining medications. So again, we're using our clinical decision making. Maybe a pharmacist can quickly assess that someone's topical acne medication is not a priority over somebody else's insulin or seizure medication that is life sustaining. And I think the other thing with regulations is that we can also work with our state associations and local preparedness teams to advocate for policies and regulations that allow pharmacists to work across state lines. So we saw with recent flooding in certain areas of our country that patients were crossing state lines to try and get access to their medications. And so how can a pharmacist go across the state line to help out in a disaster and emergency? And so again, emphasizing that our role in planning and advocating for regulations during an emergency that open up access to the pharmacist is really important. Yeah, so our simulation and training is focused, and our emergency tool is focused around what individual pharmacists and pharmacy teams can control within their own communities during a local response effort. So our tool prompts pharmacists to consider which medications might be essential medications or life-sustaining. And that can be different depending on the type of disaster or emergency that's happening. And unfortunately, a disaster by definition is when, you know, resource is not available and overwhelms the system. And so no matter how much we plan or try to control for some of these things, that's the definition of a disaster. But what pharmacists can do locally is they can do partnerships with other pharmacies in the town over or regionally, so that they can shift or share medication supply or records with another pharmacy if they have appropriate agreements in place. We also want to encourage pharmacists to step up into those planning roles to help through strategic national stockpiles of medications if mass antibiotics were needed, for example, and thinking through with emergency management planners about decentralizing storage. We can really think through all of the other issues that might come up with that. Pharmacists also work with regional and national wholesalers. And so thinking about how can we equip local pharmacies with multiple wholesalers or suppliers so that if one is unable to fulfill medication orders, that they can access another supplier or have surge contracts in place.
This is really important because historically speaking, past disaster efforts have failed to adequately prepare for people who are most medically vulnerable. So when we designed this tool and we designed it through expert input, and this was something that came across very loudly from our experts, is that this tool needs to be viewed through a health equity lens. So it was important that we prompt pharmacists in this planning and preparation phase to consider those who need help the most, or who are forgotten about during disasters or emergencies. So, thinking about people who have intellectual or mobility disabilities, people experiencing homelessness, people experiencing abuse, people experiencing economic instability. And that was something that we also factored into our simulation whenever we designed that. We wanted to prompt pharmacists to think about someone coming to their pharmacy asking for resources for housing insecurity or for food insecurity, because that's our other role in the community. Of course, we have to take care of patients' medication needs, but we also have to view patient care through this, larger whole person approach to care. So I'm glad that you asked that, because that's a big piece of preparing pharmacists in the community to respond during a disaster. I think I'll just add, and I think Victoria can jump in here too about the simulation. A big reason why we're doing this is because we want to give pharmacists this opportunity to think through a lot of these questions that you just asked us and play around with these scenarios and how they would respond. And of course, like, you can't always predict disaster, and you can't always predict how you're going to respond in a disaster. But the more preparation we do as pharmacists, the more prepared we'll be. We know pharmacists are vital in an emergency. We know pharmacists can respond, but just think how much better our response effort could be if we make this level of preparation normal.
Yeah. Joni and Sarah are much more like, they put together that tool. I'm really just the instructional designer, like assistant kind of thing. But using simulation as a modality for preparing for this is like really, really important, even if it is relatively low fidelity, like paper scenarios. It is about trying to recreate some of the emotions of the experience, so people are more able to do it in the moment because they have already pre-prepared. And having that pre-knowledge and that pre-experience is all in like the objectives for a simulation of this nature. So that way they're more capable in the moment. Giving a large scale, what feels like a large scale for a conference, 12 groups of a bunch of different pharmacists and technicians working together on a relatively, or at least an ambiguous problem before they come in, like they don't know what the scenario is going to be, means that they have to account for the context that their pharmacy is in, what kind of disasters they should be planning, what their patient population looks like, and what kind of medications they might want to increase stock of in anticipation of some kind of problem. And it's not something you can just lecture on. It's something that you have to provide an active experience so that they can learn and think about the how they responded to it, so that they can prepare differently in the future if expectations didn't come out the way that they anticipated.
And I'll just add that this continuing education simulation is giving the pharmacy teams an opportunity to think through all 4 phases of emergency management, from preparation and planning through response and recovery. And pharmacists are really key players in the recovery phase after a disaster. They're embedded in their communities and are providing help long after initial response efforts and resources dry up. So pharmacists are going to be the first ones to see things like stress-related illnesses in their community, or excessive financial burdens, not being able to afford medications, food, or other resources. And that happens for a long time after a disaster occurs. But pharmacists are really well positioned to be able to support those individuals in their community who are experiencing those issues and connect them to additional resources.